Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jeanne Sarnosky, and on today's program we're going to learn a little bit more about private services at the VNA. And we're lucky enough to have with us today a few of the private services team. We have Lindsey Graham, who is the RN team leader in the private services department, and Sue Izzo, who is the field nurse for private services, both at the VNA. So thank you both for being here today. I appreciate your time.
Thank you,
Glad to be here.
Glad to be here.
So I always like to start with, before we dive right into what is private services, which I think some people think of as private duty, because I've asked people to use that terminology as well, but I'd like to know a little bit about you, and the viewers would too. So Lindsey, I'll start with you. How long have you been with the VNA, and what inspired you to get into this field?
Sure, Jeanne. I've been with the VNA for 5 years now. I was inspired because my family always had services coming in for grandparents or aunts and uncles. And so I started as a nurse, case manager in the field, and I'm happy to be part of the private services team now.
Very good. And Sue, what about you?
I've been here at the VNA for 6 years, and I started as a team leader with the paraprofessional services department, overseeing the home health aides. And I have transitioned through the telemonitoring department, and now I'm back in private services as a field nurse. I like working within the community. I worked for the Red Cross for several years.
Oh, you did? Yeah.
In various blood drives in different locations around Massachusetts, and found I really enjoyed being closer to home in my own community. And the VNA had an opportunity that I just thought was perfect, and I really do love home care.
Very good.
It's wonderful.
Have you both been on the Cape that amount of time too, or did you come here from someplace else?
I've been on the Cape my whole life.
Oh, you have?
Yes.
Oh, excellent.
Born and raised.
No, I'm a Washashore.
You're a Washashore?
I came down, my husband and I moved here 25 years ago.
Okay.
And we haven't looked back. It's just been a great way of life with 3 kids. It's a great place to raise kids.
It's a good community.
It's a wonderful, wonderful community.
Great, great. So I'm going to throw this out there just because it came up a few times. I think I used it too in the open. When we talk about, when I think of the viewers, so the viewers will know, when we talk about paraprofessionals, we throw it around casually because it's our language. Can you tell me what that is for people that might not understand what a paraprofessional would be?
Well, our paraprofessional department consists of our home health aides, homemakers, and the fabulous schedulers that help keep it all gelling together and
moving forward.
Moving forward, yes.
So a home health aide is different than a homemaker in what way?
The home health aide can provide personal care, actual hands-on care with a patient in their home.
Okay.
Such as showers, or a sponge bath or a bed bath. And they can help them ambulate using their walker. They can cue them for their medications.
Okay.
A homemaker basically is helping them do light housekeeping through their homes. It's so important to keep a clean environment, so the homemaker will go in and do things like pick up trash, take it out, throw the trash away, wash floors, clean bathrooms. Oh, yeah. Light housekeeping.
Okay.
Personal laundry.
So some of those activities of daily living that might be difficult if a person is challenged with whatever, post-surgical or something. Okay.
Exactly.
So how are private services different than, I'm thinking of the viewer, so they might say, oh yeah, I've had VNA come in. How would they know, how can they distinguish between the regular certified services, which is covered under insurance, and what makes private services different?
Well, we really try to keep a nice continuum of care for our clients who may see the certified side and then want to keep our services. So the services probably wouldn't change that much. The private part that differentiates them from certified is just the pay source, really. The private clients would be paying out of their pocket for the service to keep the consistency.
Okay.
And there are some other insurance plans, long-term care insurance policies that would assist with that payment as well.
Okay, so when we talk about the question of does insurance pay for some of these services, some plans might, is that something that we look into, or does the person getting the services look into it?
Usually a client or a patient would know if they have a plan that would cover it. They may have been putting it into something for years and then realize that this is the moment that they need to use their long-term care policy that they've had in place. We have a specialist, our private services department specialist, Trish Antonellis. She's the best resource you can imagine. She knows everything inside out. She can help somebody, coach them through how to use their long-term care policy. She will give them the information they need. She can deal with the insurance agency as well if they have the particular long-term care policy in place. And she will guide a patient through that whole process.
Okay. So if people were considering it or watching saying, oh, I could use a little help with whatever.
Right.
Easy enough just to call and get the details.
Exactly.
Yes.
So can people purchase individual services, or does it have to be a whole package of services? Can they do a menu?
It's really unique to the person. I mean,
Okay.
they can call up, and we do offer packages. We offer per visits, really whatever they're needing at that time.
What's a per visit?
Just if they need to come in, if they just need help with a shower, or
okay.
if they want someone to come in and help with, like Sue was explaining, some homemaking services, then they could come in and they could pay for each individual visit.
So what do you run into for clients now? Is it normally people that have been on service with the VNA and they, oh gee, I wish you guys could stay longer and my insurance won't cover it, so I'll pay you out of pocket? Or
We do have a lot of patients like that, and that's a good position for them to be in if they can afford it. The transition from maybe they've had certified services and they've had a home health aide that they've become very close with and they build a good rapport with them. They can continue their services in private services department, meaning paying differently as opposed to insurance. They can pay it on their own privately and have the same home health aide or homemaker. It's a real good part of the continuum of care that we do have in place already at the
Right.
VNA. So we do really try to accommodate that. But we have a good mixture of people new that hear about the services out in the community, or people that have had services in the past, and
oh yeah,
good referral system.
I'm just thinking of the viewers and what might they know or see already if they say, well, how could I use you guys? What's the selling? You know, we were talking a little bit before the show started. I mean, it would be that easy if you just needed a little bit of help from a homemaker. It can happen that way too.
Right.
Yeah.
Right.
Oh yeah.
And because we were talking a la carte versus packages, is pricing a standard for the services, or?
I think our pricing's very competitive within the community.
Okay.
And it's, again, it's based on the unique person and what their needs are. And, you know, we do have packages for people who require a lot of services, say 24/7 cases where someone is needed in the home all of the time for supervision.
Wow.
And then some others who just may want a little assistance a couple of times a week,
Right.
you know, to help with a shower, and then they may want someone to come and help with homemaking. So it, you know, it really does depend on what they need. And as Sue had said, Trish Antonellis is really amazing at getting the feedback from the interested person and putting together a plan with them that would work.
So just a phone call away, people can find out. They might not even know what they need when they call, and Trish is good at
She's amazing.
figuring
she
that out.
Talks to them and gets all their information and
Walks them through the whole process.
Oh yeah, yeah. That makes it much easier.
Definitely.
Do people have to pay up front or pay as you go, or how does that?
It's pretty much a monthly billing. They don't have to
okay.
pay up front. They would give information of who the bill should go to, whether it's the actual patient or sometimes the family or a family member would prefer to receive the monthly bill, but it is done on a monthly billing cycle.
Do you hear from family members more than end users as far as, oh gee, I heard about your services and my dad could sure use a little help with blah blah. Do you line them up that way too?
I would say, you know,
Probably more than,
there's
Oh, more?
a lot of family out there that are concerned for their loved ones, and they may live far away and they just want to make sure that their loved ones are safe, or even just that there's an eye on their
yeah.
loved one. So
We do get a lot of calls from
family, but,
yeah.
but we also get people calling for themselves as well that just, know they need a little extra
yeah.
help. So
Yeah.
And so many of our seniors are so fiercely independent, and they want to stay home, and they should stay home. And sometimes they just need a tiny bit of help. And they may, some people may not be happy about it, saying, my daughter wants me to do this, or my son is insisting on this. And then our staff will go in their homes, and they don't ever want to lose those people again. They've made new friends, they've built relationships, and they probably don't want to admit it, but it's probably the best thing that had happened to them.
Yeah.
So they can retain their independence and stay at home.
Is there a minimum usage, or can people have help for a week or months, or do they have to commit?
There really isn't a commitment.
Okay.
It is based on, some people just have an immediate need. We've seen a lot of people coming out of hospitals that just need a little assistance in the beginning, just getting back home and just needing a little extra support, and all they need us for is a week, just overnight, so that they're safe feeling home. And then others, just they know it's long term, and they want us for as long as they can have us. So it just depends.
We've had calls come in for, I remember not that long ago, a family had to come to the Cape for a wedding. And Dad had had some illnesses going on and was now in a wheelchair. They wanted him to be a part of the wedding, but they also knew that they needed to do what they needed to do, and they didn't want to have to worry about, and he didn't want it either. He didn't want them fussing over him. So we had a home health aide come in, meet him, and she assisted him at the wedding that day. It was a local wedding, and she just kind of hung around with him and helped him with his meal and kept him from not being so obvious that he was in the wheelchair and not able to be as big a part as maybe he would like to have been, without the family having to fuss over him, and, and really helped the family out a lot. And they were very pleased with the services. That was a great way to go, and our aide got to go to a lovely wedding. It was great.
And the family felt secure
and
with
the family was so
knowing someone
happy.
else had their eyes on him, and they didn't
another set of
took
eyes.
it off their list of
of worries for that day. It's a very stressful situation, even if it's a nice stress, but they wanted to make sure that he was able to participate and enjoy himself and relax.
Yeah. So who qualifies for private services? Kind of anyone?
Anyone, yeah.
Age group?
Anybody. Yep. We have pediatrics.
Oh, you do?
As well.
We do.
What, can you give us an example of how maybe the pediatric population has used the private services? I'm just thinking when viewers are watching that whole thing of they don't even know what they need until they hear.
Primarily as mothers helpers. We get a lot of moms who may have infants and other toddlers running around, and they just don't have a lot of support system around them, and they need a little help. So we come in and we can help with bathing the babies and help with feeding the babies, and or just for a little respite time. We play with the toddler so that mom can have, and dad can have a little time to just to relax. And, and so we're utilized that way as well.
A lot of multiple births too.
Yes.
People that have twins or triplets.
Right.
They need that extra pair of hands. So it's mother's little helper, or
good idea.
Extra pair of hands, especially in that situation.
Are there physician orders needed? Is a physician in the loop with all of this?
We have physician's orders with our nursing care. We do provide nursing visits as well through private.
Because we've only talked about home health aides and homemakers, so we can talk about.
And physical therapy, occupational therapy, we have social work services,
speech therapy.
So all of those services would require a verbal order from the doctor, but our clinicians are the ones that kind of put that in place.
That happen?
They make that happen.
Okay.
They have the contacts.
Yeah, and as a field nurse, I do go out to see a patient who may need medication pre-fills. Sometimes they have so many medications, it's hard to keep track of them, so they have a small med cassette, and I would go in and fill their daily medications, morning, evening, so that they would have 2 weeks worth of supply. And I will oversee if they need a new prescription, or if there seems to be, we're unable to do a refill. I have called prescription refills in at their pharmacies, or a lot of them have mail away. and they have a tough time navigating that phone system. So we can do that for them, get their refills and get their medications lined up and stay on top of it. And it's a good way for us to also see a patient and assess them and contact a doctor if we see something, or a family member. But we do work with the doctors based on each patient's needs at the time.
And then people are, again, secure in knowing something like a 2-week pre-fill on the meds, that at least they're in order to be taken at the right time of day, the right ones, on which day.
Exactly. Yeah.
So if someone is not on VNA services right now, through what we call certified, which is those services covered by insurance, can they still have private services? They don't have to be with the VNA first before they call you?
No, most definitely not. They can give us a call and start their relationship with us.
Okay. And something like the PT-OT speech, that probably comes because of a certified case. They've already had the VNA in there under insurance, and say if it's PT, a knee replacement, gee, I wish they could come a couple more times because I'm not quite
where I want to be. Yes,
where I want to be.
We have seen that frequently, and sometimes they just need that little extra tweak of help that insurance may not have covered them for that time frame. Their time frame is up, and they can have them come in for as long as they feel that they want to have that. It's a service that they will control that.
Right. So viewers should know when the nurse leaves, if that's the end of the coverage, that doesn't mean it's the end of the care. If they don't feel right, they can still have that service. It just comes out of pocket.
Exactly.
And we see it actually more in the winter months, the therapy, because people might be ready to transition, but they don't want to be going out into the elements, and they'd prefer someone just to continue that in the home for just a little bit longer.
Just a little extra.
Oh, yeah.
So
you're able to do that.
Yeah.
So all kinds of options available for people.
And we have a telemonitoring program where it is through certified, covered for a certain period of time, through certified, meaning insurance will cover it. Some people may get discharged, and we deal with a lot of cardiac patients, pulmonary patients, and the security of having that telemonitoring system in their home gives them a little more peace of mind.
We should tell the viewers what a telemonitor is, if we're going to talk about that.
But it's just a really good service that gives people, patients, peace of mind. It is it's a little unit that does blood pressure, pulse oximetry, meaning your O2 sats, heart rate, and it has a scale. Certain cardiac patients would use that. And people get on at a certain time. The monitor has a lovely little voice. Lady starts talking, saying, "Good morning. It is now time to take your vital signs." And the person will follow the cues. It walks them right through it, the little lady in the box. They think there's somebody in there. And it actually, the information is transmitted through the telephone system that they have in their home into the VNA in Hyannis. We have a central station with nurses that triage the information that comes over. And the value, they look at daily values and report them to a doctor or a nurse case manager. And it really is a comfortable thing for the patient to have. It gives them peace of mind, knowing that their blood pressure is in control.
Somebody's checking it
Somebody
on a daily
is looking in on them remotely and regularly. And that's a very good service that we like to, a lot of people like to continue that. They don't want to see that go away at the end of their certification period with insurance, so they will keep that on, and they can keep that in privately as well for however long they choose to.
Yeah, nice. So let's talk a little bit about the staff themselves. What kind of, are they accredited and safety checked? There's a lot of, I'm sure viewers are aware of a lot of different people that are out there working these kind of services. They're sort of smaller groups or individuals, but we do a little bit more.
Yes, I feel we take great pride in the team players that we have working for us at the VNA, and not only the VNA in whole, but in the paraprofessional department. They are checked by Corey when they're they are hired, and
what is a CORI?
A CORI check is essentially a background check.
Oh, okay.
A criminal check.
Criminal background check?
Yeah. So that is.
And that happens through the state or whatever, something's filed with the state and you go look them up. And
Human Resources handles that end of it.
Yeah.
Yeah.
And then we do supervisions regularly with them. They are certified. They have monthly in-services to keep them current with disease processes, just safe transfer ways. They really do get a lot of support, I would say, from our department.
From inside.
Yeah.
These are amazing people that go out they're going into a person's home, and these are the most caring people that you'll meet. They're just so, this is what they do it's not just a job to them,
right,
and not just a way to make money. It's almost a vocation to them, because they go out and they're really helping a person in the shower. That's a very intimate moment for somebody, and if you're not comfortable with a person, a lot of people aren't comfortable with having their son or daughter help them in the shower.
Oh, right.
They'd rather have somebody who is a trained professional. And the people that we have, both men and women, are just amazing. They're just wonderful, wonderful people.
That's a good point, men and women.
Yes.
Do you want to talk about that?
Sure.
Because I'm sure clients, do they request?
They do. Yes.
They do.
Yeah.
Men will request a male.
Yeah. Yeah, so that's available.
Yes.
Yes.
Oh, yeah.
So
definitely.
for viewers to know, there are choices when it comes to that
There are
kind of thing.
choices, and
Yeah.
they're great. They're just very caring, good-natured, and happy to be doing their job, and it shows.
Yeah. And then insurance, because we're a larger organization, we're insured for any mishaps, or
Oh, yeah.
is that something that makes us different than some of the other agencies out there, or some of the other maybe small mom and pops?
Well, yeah, we're bonded, and we fall under JACO guidelines.
Joint
So
Commission, so there's a
we have standards.
certain standards that we need to
Standards
meet.
and practices that we do need to meet for all VNA staff. We're all held accountable for the care we provide based on a care plan, and I think they
Keeps everybody safe.
They keep us all very safe and secure.
So what if you have, or have you had, maybe a couple, more than one person in a household that need services? Is that something that can be arranged?
Oh, definitely.
Oh, yeah.
Yep, we have quite a few.
Oh, you do?
Yeah.
Oh, yeah.
Yeah.
It's
What
really
happens?
nice.
One of them gets it, and the other one goes, hey, I could use some help like that.
Yeah.
Pretty much.
Yeah.
Does it? Yeah.
Yeah.
Good.
Shared visits. Yeah.
Shared visits, yeah.
Yep.
Yeah.
And there are different rates for that, which
Oh, good point.
Trish would, assist them with if they called, but essentially the home health aide, or whichever discipline it is they need, would be there for the whole length of the visit to help both of them at the same time.
Yeah.
So
What if it's something as simple as, gee, I would like a little respite for my mother? Is that doable?
it sure is.
Caring for the caregiver.
Is it?
Yeah, we have a Caring for the Caregiver program, and that happens
that's
a
a good-
lot. Yeah, a
that's
lot
a
of
descriptive.
caregivers, are family members, and they have their own lives and their own jobs and families to try to take care of, and it's a balancing act to help their mom or dad or aunt or uncle or whomever. So they might need a break for themselves, and that's where
something you can provide.
yeah, home health aide is more than happy and willing and very competent to do so.
Yeah, good. So what about, is there a contract period of time once they're signed on with private services? There's no commitment to,
No, there isn't a
As long as they
commitment.
choose.
Yeah.
so it's very, very flexible. So I'm thinking of, again, I'm thinking of the viewers, what kind of things would they have going through their mind so I can just use you once and off I go, and maybe in another 2 years I have that same feeling. And
Well, I think that's how we feel, that everyone's lives change day to day, and to be held into a commitment is not fair. So we want to make their lives easier and help them sort of roll with any adjustments. So a commitment wouldn't be realistic.
yeah.
Each person is unique and has a unique need. As I said, we could have a patient or a client that we have been providing private services care for that may have a wedding coming up. Just like I mentioned,
yeah.
we had off-Cape people come, and we provide those services. But we do have, you know, for our regular folks too, who we have on services already, if they need somebody to take them to a wedding, you know, to go with them to a wedding, to keep an eye on them. They're comfortable with the person they have coming in their home, and they just want to, again, not have to be too much of a burden on their family at a special time like that. So you could have an extra day. You could, you know, just add a day for
so you
whatever
can fill
need would
almost
be.
any circumstance.
Pretty
What if
much.
someone's with another agency? Could they still use the VNA services, private services?
Yes, there's some
So you
clients.
work with?
We work with other agencies. There's some clients that need a lot of care, and maybe the other agency can't give them all the time they need, and so they'll come to us, and we'll fulfill that, and then hopefully, you know, as hours increase or they need more, that they use us more.
So believe it or not, we have about a minute left. So I'm wondering, is there anything that we haven't talked about quickly that you wish we would have touched on?
Well, each
Covered it
person's
all?
unique. I think we've covered it all, and it doesn't hurt to make that phone call to ask our specialist, Tricia Antonellis, who has been with the private services for a long time, knows it inside and out, and can answer every question pretty much.
All right. Well, Lindsey, thank you so much for being here, and Sue, you as well. I appreciate all your wisdom and information. All right. So I'm Jeanne Sarnosky, wishing you good health and good health care.